As of July 20th, the number of hand, foot, and mouth disease or HFMD cases in the nation increased almost 50% to 34,670 cases compared with the same period last year. China Press reported Deputy Health Minister Dr. Lee Boon-chai as saying that there had been a spike in HFMD cases in all states except for Sarawak. The outbreak hit 29 schools and hundreds of more kindergartens and daycare centers.
In a statement, TO said a total of 17 schools had recorded HFMD cases in Johor, followed by 16 in Selangor and 10 schools in Sarawak. The number of students infected by the disease caused by the viruses, particularly the Coxsackie A16 and enterovirus 71 on Thursday, stood at 176, comprising 64 preschoolers, 103 primary school pupils and 9 secondary school students. Teo also said the HFMD had caused the closure of 6 preschools and 12 classes, including 9 in Kuala Lumpur, 3 in Perak, 3 in Selangor and 3 in Johor, to allow these places to be cleaned to prevent the infection from spreading. The ministry would also be keeping a close watch on things in the schools because HFMD was a very contagious disease, especially among children. She also urged parents and teachers not to take children to public areas as a precautionary measure and to reduce the risks of being infected. Teachers were also reminded to stress on the importance of personal hygiene among their students and on the cleanliness of their surroundings. Earlier, it was reported that health authorities had recorded up to 33,425 cases of HFMD nationwide this year. Health Director General Dr. Nur Hisham Abdullah said most states had shown an increase in the number of cases this year compared to the corresponding period last year, with the exception of Sabah and Sarawak. It was also reported that 418 premises had been closed so far, including 198 child care centres and 197 kindergartens.
其中一间凌晨的一间学校被关闭，然后29间这个学校里面呢，一些是科室，一两个科室被关闭，这个幼儿园、托儿所啦，215间被关闭或这个kindergarten 220间，所以一般上我们只是指示他们暂时关闭10天。使到这个疫情不会继续再传染，所以10天过后他们可以继续再开放。
Dr. Lee added that even though there are no deaths reported, the disease should not be taken lightly. Children and their parents are advised to maintain a high level of hygiene to further prevent the outbreak.
Bernama, Tarinjaya. The number of hands, foot, mouth and disease cases in Malaysia has increased by 28% as at June 30, said the Health of Ministry. He said currently there are 341 preschool, daycare centers or kindergartens that have reported HFMD cluster in their premise, which is 50% of the total outbreak reported by this year. We will call our reporter Mrs. Umay to report about the HFMD cases.
Thank you, Shahira. Now, a case in Nibong Tebal bernama a 70-month-old boy died in Penang on June 6 due to the hand, foot and mouth disease, said the Deputy Health Minister Dr. Lee Boon-chai. He said it was the first fatality in the country due to the HFMD, and that laboratory test done on tissue sample from the boy confirmed that his death was because of that disease. The boy was admitted to a private hospital in Bayan Lepas, Penang on June 3 after experiencing flu, breathing difficulty and mouth ulcer, but his condition deteriorated and he died 3 days after receiving treatment at that hospital. The specialist carried out the test and confirmed that his death was due to lung infection as a result of complication from the enterovirus, which caused HFMD. Thank you. Back to Shahira.
Thank you, Ms. Umay, for the detailed report. That is the recent news about HFMD disease. We Before we end this news, let's watch this clip on the advice about the awareness of the serious disease from Dr. Rania. Thank you and have a great weekend.
I want to ask one question to Dr. Rania. How to make parents aware about the HFMD for their children?
Okay, basically HFMD is a viral infection which spreads more commonly among the children. So in most of the children it stays as a mild illness, like it creates some lesions on the skin and just go off. But in some children, especially in the children who has low immunity and who are very small, such children there is more chance for the infection to become systemic, that is it spread to the throat, the chest, and can create more complications. So basically the parents have to make sure that when a child gets some lesions anywhere in the body, they must immediately contact the nearby hospital and make sure that the child takes some medication. Now basically there is no specific treatment, only we have to treat the whatever disease is coming. But the main thing is that we should not allow the disease to spread. For that, what we have to do is we have to take the child, whoever have disease, we should not allow them to go in public place. We should keep them at home, or we should not allow them to go to school. The parents must really take care of that, because if they go to school, they'll spread to the other children.
You have to quarantine them.
Yeah, the thing is the disease spread in the first week. If the child gets the disease, first week it's spread to all. Second week it's okay, it won't spread much. So that first week you should keep at home the child. And whenever that we are taking our children to the park, to the malls, or anywhere in the public place, we should make sure after we finish the trip, we should make sure we wash the hand of the child. We also should wash our hand thoroughly before eating, before touching eyes, nose. Without washing, it's very dangerous. It can spread easily. So we must take care of these things, then we can prevent spreading of the disease.
So Dr. Rania, your last word to all Malaysians about HFMD.
Basically, HFMD is a viral infection which spreads in a fast pace from schools to schools, from one place to other, and we have been seeing in news how the HFMD disease is been spreading throughout the Malaysia. So by knowing few facts like HFMD is a disease which can be easily prevented by some few measures, which includes that simple washing of the hands with soap of us and also our children's before eating, before touching our eyes, our nose, or anywhere else. And also the HFMD is found to be spreading in the malls, in the public places, in the parks where children spend a lot of time. So making sure the children wash their hands before after coming back from these places, and making sure that our sick children, if they have any rashes or fever or any other difficulty, we must make sure that the children is not taken to the school so that they won't spread the disease to the other children. In fact, these are very few simple steps, but these few simple steps can cause a very, very massive change in the entire Malaysia. Because this disease is in fact causing the death of many children, especially those who have low immunity and the children who are very small, like including the infants. So my sincere advice to all Malaysians is to follow these simple steps, which includes proper hand wash of our children, of ourselves, and also to prevent our diseased children from going to school so that they won't spread the disease to the other children. And by following these measures, we can in fact not only prevent the disease but also eradicate the entire HFMD disease from the Malaysia. Thank you.